So, Marc, do you think halitosis is an important issue?
Well, if you read the literature and knowing from what I have seen in Belgium, I really believe it's a big issue. And we think that around 20 to 30% of the population is suffering from it. The only uncomfortable situation is that people are considering this as taboo. They don't like to talk about it. Patients of persons even don't smell their own breath. So there are a number of patients with bad breath, but they even don't realize it. So from that point of view, the diagnosis is very important.
So, let's say that the oral healthcare professionals have a role?
Yeah, definitely, since the majority of the causes for bad breath are within the oral atmosphere, tongue coating, gingivitis, periodontitis. It is the obligation, responsibility of oral health care people to cover this issue. They should talk about it, they should diagnose, and they should inform the patient.
So, you think that you should inform your patients, you should reveal that they have halitosis even if they are not aware?
Definitely, because they don't know that they have that problem, and probably the environment is suffering from it. So it's our responsibility to do something about it.
How do you think it would be a nice approach?
To do this?
Yes.
Oh my God. What we do in our practice is that we ask the patient, do you sometimes suffer from bad breath? And then this jumps in their mind and they immediately respond, do you think I have a bad breath? And then it's easy for me to say, yeah, well, I can smell something. Should we do some extra diagnostic tests? And then you can start your treatment, your diagnosis, and then the treatment.
But if they don't say it, if they don't ask you?
Well, we have, let's say, patients that are really coming to our clinic because they are informed by their environment that there is a problem, but also you have patients in your office that come, for example, for periodontal treatment or for something else, and then it's our role to inform them that they have a bad breath.
What is the etiology of halitosis?
Good question, thank you. We know that from those that really have a bad breath, because there is a small group of patients that believe they have a bad breath, but in reality they do not have. We call it pseudo-halitosis. But those that have a bad breath, we know that in 9 out of the 10 patients, the problem is within the oral cavity. And as I already said, it can be tongue coating, gingivitis, periodontitis, combination of those, and some extra things. And in a minority of patients, it can be related to an ENT problem, a gastrointestinal problem, a cancer, lung cancer, or something like this. But that's just a minority.
What is a minority, these percentages?
It will be not more than 10%. It could also be, for example, a systemic disease like diabetes, or so if you take that together, it will be less than 10%.
So, what about children? Is the same etiology?
We do not have a lot of publications about the etiology of bad breath in children, but as far as my own knowledge goes, it is, of course, also possible a problem in the oral cavity, but more we see in those patients a problem with in the ENT area or a problem with the tonsils.
What are you going to cover in your presentation in Europerio 8 in London?
I would like to talk about the diagnosis of halitosis, and there are some new findings that show that some of the devices that we often use are perhaps not the best to be used, and also in the technology there have been some improvements. So I think these are really important aspects.
So it's going to be really interesting for the clinician?
Of course, it has to be interesting. Silvia, what are you going to cover at the Europerio 8 meeting in London?
My presentation is going to be about treatment of halitosis. So it's very real, complex issue to cover.
because you have different etiological factors?
Exactly. I think that the treatment should be tailored in some way to any patient, to every patient.
Yeah.
So it depends on the causes of the halitosis. Our treatment should be focused on that. So as you said, the tongue coating is one of the main causes of halitosis. So it's probably one of the main measures that we apply to our patients is the tongue cleaning.
Yeah.
Always that the tongue coating is present, of course. And as you said as well, gingivitis and periodontitis is one of the main causes as well. So we need to treat our patients with a conventional periodontal therapy.
Yeah. And are you going to include more recent observations, more recent studies on the treatment of halitosis?
We will update all this data, but you have to come to London to see it.
Okay, thank you very much.